Good day, everyone. Welcome to another lecture series of Bio 2. Today, our topic is on infectious diseases. My name is Bamidele Odumosu. Journey with me. Infectious diseases are illnesses that are caused by microorganisms such as bacteria, virus, fungi, or parasites that can be passed directly from the infectious agent such as bacteria to humans, or can be passed indirectly from one person to another. Now, these infectious diseases are common causes of death worldwide, particularly among the low-income countries, and these are found usually among children. What are the factors that lead to infectious disease in low-income countries? We have poor sanitation, malnutrition, limited access to healthcare, crowded living conditions, climate, environment, education, poor health infrastructures, and inadequate coverages. Now, for poor sanitation, lack of access to safe drinking water and proper sanitation facilities and good hygiene can lead to the spread of infectious diseases. For malnutrition, when people are poorly malnutrited, when they don't feed on adequate diet, it can lead to weakened immunity. Immune system is composed of protein. Lack of adequate protein in our food normally lead to people being susceptible to infectious disease. And limited healthcare facility is also one of the causes of spread of infectious disease. Poor infrastructure, health condition, and services, including poor medical staff, diagnosis tech, lack of diagnosis tech, and medicine, normally lead to this. Then crowded living conditions in densely populated areas such as slums or refugee camps. Infectious disease can easily spread from one person to another because those places are poorly spaced and they are crowded. So infectious disease can permeate all these areas. Climate and environment also add to this because when we have a humidity and temperature lead to emerging infectious disease and spread among individuals. The lack of education and awareness about infectious disease and their causes and prevention strategies can lead to the spread of infectious disease. When we have poor public health infrastructures, this also lead to spread of infectious disease among low-income countries. This includes surveillance system, disease control programs, and emergency response capacity among low-income countries. Then lastly, inadequate vaccination coverage. When there is no adequate vaccination for children, it can lead to outbreaks of infections such as measles and rubella and other infectious diseases in low-income countries. Agents that cause infectious disease are largely pathogenic bacteria or pathogenic organisms, so to speak, and this includes virus, bacteria, fungi, and so on. So pathogenic organisms are those organisms that are disease causing. They are microscopic in size, we can't see them with our naked eyes, and they are usually dispersed or spread in the community. Although microbes can be agents of infectious disease, not all microorganisms are responsible for infectious disease. In fact, we have microbes that inhabit the human body, those that play beneficial roles in human body. They are not the ones that are responsible for infectious diseases. Those that inhabit the human body are those that are beneficial. Among them, we have bacteria, we also have single cell eukaryotes that inhabit the human body. We depend on them to help us digest our food, produce certain vitamins, and regulate our immune system. They keep us healthy and protect us against disease-causing bacteria and viruses. They are not responsible for infectious disease, but they are good and they are beneficial to our system. However, most agents that cause infectious disease are usually bacteria or viruses. Mostly, we have bacteria and viruses that are mostly implicated in infectious diseases. Although parasite cause malaria, it's also a notable example of an infectious agent because it can directly infect people. But malaria itself as a disease is not infectious, but we have an infectious agent that can cause malaria. Let's look at the example of viral infectious diseases. We have so many viral infectious diseases, but we are just going to mention very few among them. And we have the COVID-19, which was the recent one that had the pandemic effect. And we have the influenza virus, we have the HIV/AIDS, we have Ebola, we have diarrhea disease, we have hepatitis, and we have the West Nile disease. Among these are those that are usually caused by virus largely. And we have so many that are not listed here because of our time. We also have bacterial infectious diseases that are commonly encountered all over the world and especially among the places already listed. Example, we have the anthrax, we have the tuberculosis, we have salmonella infection, those that are usually foodborne. We have the respiratory disease and infection caused by bacteria. We have the diarrhea diseases, we have meningitis that are also common in the environment, especially in certain places. Now, how are infectious disease transmitted? Infectious diseases are transmitted by certain routes, such as number one, contaminated food, contaminated water, fecal materials, body fluids, animal products, and air. These are routes of transmission. Contaminated food, when food are contaminated, can lead to outbreak of infectious disease, as well as water. The fecal material from infected individuals that are poorly disposed in the environment, open defecation, and also inadequate disposal of fecal material or content from animals that are infected, especially if an animal is infected by anthrax. And the cattle dung can be spread along farms where people can harvest these plants and consume it. It can cause infectious disease. Body fluid is very common one. Blood, serum, and semen or other body fluid from individual can lead to infectious disease if you get in contact with susceptible hosts. And we have animal products such as meat, egg, dairy, so on and so forth are also route of transmission of infectious disease. And lastly, the air. The air is one important route of transmission of infectious diseases. That's why sometimes people are advised to cover their nose when they are already in an environment that are prone to infectious diseases. Factors affecting infectious diseases in the environment. Number one is the route of transmission. This is very important because the route of transmission determines how fast, how rapid an infection can be transmitted. For instance, an infection which is transmitted to the air has a greater potential of infecting a larger population of individuals than an infectious agent that depends on direct contact. And some agents can be spread through water, though these have to be commonly experienced in places where we have large water bodies and it may not be common in places where there is no water. For instance, in the desert, there's no water, so infectious disease transmitted through water is largely not present in such environment. So the route of transmission determines how fast, how rapid an infectious agent can be transmitted. Another factor is the survival time of the infectious agent. This is time taken for an infectious agent to survive outside the host. An agent survive only few seconds between hosts. An agent that survive only few seconds between hosts will not be able to infect as many people, depending on how long they can stay in the environment. Some agents can stay for few seconds, for few hours, days, or even longer. So this factor is important to determine how fast people can contract this infectious agent from the environment. And these factors are important consideration when evaluating the risks of potential bioterrorism agents. How long can they persist in the environment? If an infectious agent that can stay few minutes in the environment, that means there's a chance of it not being spread to people when they come in contact with the infectious agent in the environment after it has been disseminated by an infected individual. a virus infectious disease. Number one is COVID-19. COVID-19, also known as coronavirus disease, is an infectious disease caused by the SARS-CoV-2. SARS-CoV-2 is an acronym of severe acute respiratory syndrome, which includes illnesses of common colds common among the Middle East and Asia. This disease was previously known among these areas. It was endemic in those areas until 2019, when a new strain, a new coronavirus strain, was identified and it led to an outbreak. This originated from Wuhan in China, and it was designated as COVID-19. It infects people and it causes severe acute respiratory syndrome among people, especially people that have underlying diseases. It is supposed to be a mild infection, moderate to mild infection, and people can recover without any special treatment. However, when people that have underlying diseases and people that are sick or elderly people, usually these kind of people can have severe experience, and often it can lead to death. Example of people with underlying disease such as diabetics, chronic respiratory infection, cancer, or people with HIV, tuberculosis. Usually they normally undergo severe experience under this infection. Anyone can be infected with coronavirus and critically ill or die at any age, but people with immunocompromised states usually experience more severity of this disease. And symptoms of this disease ranges from shortness of breath, muscle ache, chills, sore throat, runny nose, headache, chest pain, pink eye, nausea, vomiting, diarrhea, rash, and several other infections, including cough and tiredness and fever. So these are symptoms of COVID-19. Some people can experience these symptoms altogether, while some people can experience just one or two, depending on their immune status, depending on their state of health, depending on their and the strains, compatibility with their health system. How is COVID-19 spread? It can spread from an infected individual's mouth or nose in liquid particles when they cough or sneeze, and this can spread through air droplets to smaller aerosols, and susceptible individual can breathe in this COVID-19 virus and get infected. However, to prevent the infection, it is important to practice respiratory etiquette. For example, when you are coughing, you have to cough in between your elbows. Don't cough with your hand covering your nose, because you can pass this virus to your hands and shake people. Avoid shaking hands with people who are suspected uh, individuals, or people who are persistently coughing. Supposed to cough with their elbow or use a tissue paper to cough. And when you get home every day, make sure you wash your hands clean with soap and water. And if you suspect that you are having any type of such infection, make sure you self-isolate yourself until you recover, so you can prevent other people from contracting this disease from you. COVID-19 is still in the air, although it may not be endemic in some countries, but the virus is still in the air, and it is advisable that people should prevent it from spread. So we have come to the end of this part 1 of infectious diseases. In our next class, we'll be looking at more about these viral diseases and bacterial diseases. Thank you for your time. Make sure you subscribe to this video. to subscribe to this channel so that more videos can drop and get alert to your phone immediately we drop the video. Thank you very much.